So your collarbone or your clavicle is the bone that attaches sort of the middle of your chest out to your shoulder. It is really common to break mountain biking, snowboarding. I had a teammate in high school who broke his collarbone playing football and finished the game. So they come in a lot of different varieties. A lot of the time your collarbone doesn't actually need to be fixed. That being said, it's always important to get an x-ray and determine whether you're in that category or not. It's a non-weight bearing bone, but if it breaks and is separated to a certain amount, it's always better to fix it so that you don't have long-term problems from that. And so if you have pain sort of along the line of your chest, usually people know when they have a broken collarbone because they have a little bump or a spike or a lot of bruising from a trauma going over the handlebars of your mountain bike or anything like that. So we should always get an x-ray and make sure that you don't need surgery, but a lot of the time they can be treated in a sling and heal on their own, especially in younger patients. We can fix them. Usually it's a surgery where we make an incision over where the fracture is, put a plate on, put the bones back into place, and then let them heal. And those plates are designed to be permanent. Sometimes they cause a little bit of irritation and need to get taken out, but it's rarely a problem. Other things that can happen as you can have an AC separation. The A stands for acromion, which is your shoulder blade, and C stands for clavicle. So if you have a separation between your clavicle and your shoulder blade, then sometimes you'll have a big bump on the outside of your shoulder, and it could look like a broken bone or it could look like an AC separation, and an x-ray will confirm that. Again, most of the time AC separations don't end up needing surgery, but it's always better to have an x-ray done of it so that we can determine whether or not it needs to be fixed.